15th of June 2025, and the theme is caring about equality. So if you could please click on the link I've just posted and open that up while I speak, if you don't mind. I think it's better to sort of clear out some time from this for this. What we're hoping to do is to get some ideas from you or potentially some content for Carers Week. So as you open up that form, if you could start filling it in, and I will talk you through it. Has everybody got access to that form? Is that working for everybody? Can you, yeah, brilliant. Thanks, Campbell. Always a bit of a fear. So obviously we've got your name and organisation, so please pop that in now. Your email contact so we can get back to you. Please pop that in now. If you could put your NHS region, because we're quite keen, as always, to get as much sort of spread across those regions in terms of any content or any feeding into this, so we get that lovely spread. We're not leaving any region out there without being able to contribute. You can see the themes. There are 7 themes across the week, but we're concentrating in terms of those sort of physical presentations on the first 5 during this conversation. The first one is health and social care. We're asking, have you got any suggested speakers or presentations from your region? So if you've got any good examples of sort of working between health and social care, please pop those in. The next one's financial well-being. Again, any really good examples, please pop those in. I'm looking forward to going back and looking at this after the meeting and seeing, we've had no responses so far, I think, seeing all the wonderful ideas you're putting in. 11th of June, work and employment is a theme, obviously framed around unpaid carers. The 12th is young carers. Again, I'll share the link again at the end for people who have joined a little bit later. Young carers, again, if you've got any ideas. And then Friday, older carers. If you've got any ideas, please pop them in there. There's a box there saying, would you be willing to support or would you be willing to host? Because we feel it's really important, actually, that there's the opportunity there for people around the regions, around ICS, actually to sort of have a bit of a voice and have the opportunity to host a bit of a national platform. And then any other comments. So I'm hoping, I should have showed that on screen, that you've all had the chance to do that, and then please don't forget to submit. Again, for people that are turning up a little bit later and didn't get the chance to see the link, what we're talking about is, can't spell survey, is hearing from you about contributions to Carers Week. And I'll just give the theme again for people that turn up a little bit late. It's the 9th to 15th of June, and the theme is caring about equality. Thank you, Campbell. Is that okay?
That was splendid. Thank you very much. Jim, what's the deadline? What's the closing date for the survey?
The closing date is next Wednesday, as we sent it out Wednesday. So we have got a little bit of time. But as I say, I'm hoping that we get some really good feedback and ideas this morning as people have filled it in as we've gone along.
Brilliant. That's absolutely tremendous. Thank you very much. I encourage anyone from the north to fill out the survey. Many thanks for joining us this morning. My name is Campbell, and I'm a regional care lead, experience care lead in the North East and Yorkshire region of NHS England. I've got a little bit of housekeeping before we kick off. So I just want to say that this meeting will be recorded. If you don't want your face on the screen, please do turn the camera off. We have placed everyone on mute to avoid background noise. Please use the chat box to let us know if you're having any technical difficulties, and where possible, post any questions or comments in the chat box throughout the event so that we can make the best use of time. We'll make sure that we have a proper Q&A at the end of the presentation. Next slide, please, Steve. So what I'd like to do today is introduce you to Fiona Richardson, who's an Employment Engagement Officer at Newcastle Carers, and to Faye Gates, who's our Project Support Manager at Northumbria Healthcare Trust. Fiona and Faye are going to talk about an absolutely brilliant project that they've got in the Northeast supporting carers. And I'm really interested in this because we know the impact that caring can have on carers. And we also know that 1 in 3 of NHS staff, for example, have a caring responsibility. So this presentation and the work that they are doing is timely, and it's also extraordinarily useful. So without any further ado, I'd like to hand straight over to Fiona, who's going to take us through the presentation. Thank you, Fiona.
That's brilliant. Thank you very much, Campbell, and good morning, everybody. As Campbell said, I'm Fiona Richardson. I am the Employer Engagement Officer at Newcastle Carers, and we're going to talk to you a little bit today about the project that we're currently working in partnership with the Northumbria Healthcare Trust. I'm just going to let Faye introduce herself while I put my slides on the screen.
Yes, morning everyone. I'm actually standing in for my manager, who is Joe Mackintosh, who's the Chief Experience Officer with our trust. But I'm Faye Gates, I'm a Project Support Officer in the Experience team at Northumbria. And I've been working alongside Fiona and Alistair on the Working for Carers project.
Great, thank you, Faye. And I just saw a message pop up in the chat as to whether or not the slides will be shared. Absolutely. So you don't need to scroll frantically as we're going through this. We're more than happy to share the slides with you and more than happy to share to answer any questions that you might have. So just to start off and just to set it into context and into background, I think we really should start with that question as to who is a carer. So we know that we get definitions of carers from the Care Act, and in terms of adult carers, they are people who provide or intend to provide care, and we also get them from the Children and Families Act in terms of young carers, our young people under 18 who again provide or are going to intend to provide care. But generally what we tend to look at is a working definition, which makes it easier for everybody to understand. And this is the working definition that the majority of local authority areas use. It just helps put things into context, and this is usually where we see a bit of a light bulb moment coming on, because a lot of people who are providing care and support to somebody do not realize that they are carers. It's one of the biggest issues that we have in terms of identification. So for us, it is somebody who provides unpaid care and support. That's key because the term carer is interchangeable. So we have paid care workers who are called carers, so for a lot of people, it's really about how we frame this. And what we're looking at is really that care and support to somebody who can't manage without the help, whether that be illness, frailty, disability, mental health, substance misuse, combination of them all. And again, linking to that, that's people like me, people people you work with, and people who you employ. Now, the project that I'm going to talk about, is up into the northeast of England. We cover 3 local authority areas. So we cover Newcastle, North Tyneside, and Northumbria. So a lot of the information that I'm going to give you is relevant to that particular area. But I am happy to provide. What do we know about carers? We know that every day around 12,000 people become unpaid carers for somebody, and about the same amount stop caring. So it balances out. We know from the census that there are nearly 6 million unpaid carers in the UK. And I'm saying we say at least because the census was done, 2021 when we were coming out of COVID. There were still a lot of restrictions in place, and we don't really believe that that gives us an overall true view of how many people are providing unpaid care in the country. We would estimate, as would Carers UK, that the number's nearer to 10 million. Yeah, but from the census information, what we do know is that 2.5 million of those unpaid carers are employed, which equates to 1 in 7 in the UK workplace. In terms of the NHS, and Campbell's already made reference to this, we know that 1 in 3 people working in the NHS are unpaid carers. And I think it stands to reason that people who provide unpaid care go into caring roles. And that would explain a lot as to why we have so many people caring in the NHS. In the Northeast itself, we have the highest percentage of people providing the highest amounts of unpaid care. So across the North of Tyne area, which is, like I say, Newcastle, Northumberland and North Tyneside, we have just over 75,000 unpaid carers. We've broken it down into local authority area for you, but I think what's really, really key for me is that at least a third of those unpaid carers, so at least 25,000 of those, are providing over 50 hours of care a week. And they're living in the highest areas of social deprivation in our particular region. So if you combine that caring along with issues faced by poverty, etc., and then add work into the mix, that's a real struggle for a lot of individuals in our particular area. We know that caring can be very, very rewarding for a lot of people. You know, people get an awful lot out of looking after someone, but the longer that you care and the longer in terms of time or in terms of hour, the more likely you are to experience some significant impacts. So we know that in terms of a carer's health and well-being, you're more likely to experience long-term health conditions or disabilities more frequently than people who don't care. If you think that you're caring for somebody, I don't know, 25 hours a week and increasing that, you are more likely to experience loneliness and isolation. And that's linked to the fact that you are not necessarily able to carry out your normal social function. So, you know, with friends, family, etc. That loneliness and isolation can lead to conditions like stress, anxiety, depression. We know it can affect your ability to be in paid work. We know that many people give up work, training or education in order to care, and we know that it tends to be women. So we know that women are disproportionately affected by caring. We know they come into their caring roles into their mid-40s, whereas for men, and men do care, don't get me wrong, we know that they tend to come into their caring roles perhaps in their mid to late 50s. So if you think about work and employment, if I'm and I'd like to think I was in my 40s again, but if I'm a 40-odd-year-old woman, chances are I've been working for at least 20 years. I've got lots of skills, lots of experience, and it's generally the one thing that's going to give. So if you think about that and then link that to my relationships and my finances, it's going to potentially add some additional strain. You know, if I'm a 2-salary household and all of a sudden it goes down to 1, that's going to have a significant impact financially on me and my family. And in terms of caring for someone, we know that paying for things such as aids, equipment, transport, etc., can further impact your finances. Now, with it having been Young Carers Action Day yesterday, I think it would be rude of me not to mention the impact that caring for somebody can have on young carers. So if you think of all of these and then add to it the difficulties around schooling, education, lifelong chances, the impact for our young carers is amplified. There is a massive, massive business case, both economically and otherwise, for supporting carers in the workplace. We know that a good employer can attract and retain staff. So I am an unpaid carer. I've been an unpaid carer for 21 years. And during that 21 years, I have managed to maintain full-time employment. And that is linked to the support my employers over that particular time have given me. You know, that flexibility. So knowing that I'm working for a carer-friendly employers, you know, and knowing that there are carer-friendly employers out there, it does attract and retain staff. It reduces my stress, but it also reduces the stress of being managed. It can recruitment and training costs. So as I mentioned earlier, if you know you're going to lose a member of staff who's been working for 20-odd years, you're not going to be able to replace them just like that. We know that happy staff can make for increased productivity. It can reduce staff sick leave and absenteeism. It can improve your service delivery. It can produce cost savings. It improves the management of people, and actually it increases staff morale. So for me, And actually for everybody, it's a win-win situation. It's a win-win situation for the employer, and it's a win-win situation for the carer. So why the work with Northumbria? Well, I think it's really key to say that it's not just about patient care. So we know that Northumbria has around 1,600, is that right? Fair, around 1,600 staff that we're aware of that are unpaid carers.
Yes, I think the figure might even be higher than that, but we estimated it was actually over a third of our staff.
Yeah, brilliant, thank you. So some information that was done in the staff survey last year brought out just some things in terms of the staff support for carers. And what we saw was that there were some really good things going on, but actually, like everything, things could be a little bit better. And the big thing for us was consistency. So we know that some staff were, being able to speak to their managers and that their managers were really flexible, yet others weren't. We know that some staff knew about the Staff Carers Network, but some didn't. So the Working for Carers project started to work with the Trust to help and support in terms of consistency, in terms of the offer. So I'm going to go through a little bit about the project now. So it is a partnership. It's a partnership of 3 carers centres. So that's Newcastle Carers, North Tyneside Carers Centre and Carers Northumberland. And we've partnered to deliver what's called the Working for Carers project. It's to support unpaid carers who are looking after somebody living in Newcastle, Northumberland or North Tyneside. It's funded through the UK government, through the UK Shared Prosperity Fund, and the North East Combined Authority are our lead authority. So they oversee the project and the work that we deliver. Now, the project is due to end on the 31st of March. However, it is going to continue. It is going to change a little bit, but it will still continue. So what I would say is please watch this space in terms of how it's going to look going forwards, but it will absolutely be continuing. So what do? We support, and it says here, economically inactive. It's a bit of a lie, really, because we will support any unpaid carer 16 plus to move towards paid employment, education, training, or volunteering. The second strand is about supporting working carers to sustain their work and achieve career progression. And the third strand is about working with employers to improve the identification and support of unpaid carers in the workplace. Remember, there's at least 1 in 7 unpaid carers in the workplace. So we do it in a number of ways. We have employability advisors. They're providing specialist one-to-one support, exploring options with those unpaid carers to overcome or reduce work-related barriers, if they're looking to get into work, education, training or volunteering. So for example, it might be that I have given up work to care. I've had a 5-year break because I've been caring for somebody. I want to get back into employment. But actually that 5-year break, how do I account for that on my CV? So our employability advisors will work with me as that individual because those skills that I have when I am caring for somebody are transferable. Communication, organisation, all of those kind of things. So we will work with that unpaid carer to make sure that those skills are transferred onto a CV that can be presented to an employer. We have a benefits and legal advisor, so they will provide benefits and legal advice to carers engaged with our project, and that's about maximising their income in and out of the workplace. So thinking about carers allowance and the restrictions that are put in around working and claiming that and making sure that we balance that out. I think again it's also key to think about the advice that they give to us as project members, because we're not, benefits and legal specialists, so they provide information and advice to us. And I suppose the ripple effect will be that fact that often the person with care needs also benefits from that advice and information as well. Our employment advisor will work with carers who are working and look at giving information, advice and guidance to help balance caring alongside their work. training, education. So that could be thinking about things that might be able to help them to maintain their work. So, for example, I mentioned I'm a carer, I look after my mum. We have assistive technology in my mum's house. So she lives independently, but we have cameras and we have telecare, which means that we can care from a distance. And if anything goes wrong, we know that there's help readily available for her. That's really reassuring when you're working, to know that just things like that are in place. So it's using things like that. And the employment advisor will also advocate on behalf of the carer, if needs be, with their employer in terms of things like flexible working, that kind of thing. And then we have people like myself. So employment engagement officer does exactly what it says on the tin. We work with businesses across the north of Tyne, and it is about influencing change and improving outcomes for both employers and employees. So it's about improving people's understanding of carers, looking at how they can identify, engage, and offer solutions within the workplace to support unpaid carers, thinking about the development, implementation, and review of carer-friendly policies, and thinking about employment responsibilities. And that is things like carers leave, flexible working, and making sure that they're compliant with the Equal Opportunities Act in terms of that discrimination by association, for example. So the work that we are doing with the Healthcare Trust, I might be a bit biased, but I think it's absolutely brilliant. You know, we've really been, we haven't even pushed at an open door. That door has been wide open for us, you know, to work with the trust and to complement the brilliant work that they're already doing. So within the trust, we have a part-time hospital employer engagement officer, which is Alistair. Unfortunately, he's not here today because he's part-time with the hospitals and with the project. He also delivers services to unpaid carers aside from that. So he's got some appointments with carers in this morning, unfortunately. But what we're doing with the trust is looking at developing the offer of support available to unpaid carers. And ideally, and what we have started doing, is trying to get it right with staff, you know, to make sure that the staff carers who are working in the trust are suitably and well supported. So working with them through the staff experience programme, working in services commissioned by the trust. You know, we want to develop the offer of support available to unpaid carers of patients and families accessing services. And underpinning all that is, you know, what we're hoping to do going forward is to look at how we can support unpaid carers through employment, apprenticeship, volunteering opportunities, not just with the trust itself, but with its commission services, its contractors, its partners. So it's that bit of a ripple effect. So from staff rippling out to patients, families, services, etc., until what we've got is a really nice holistic package of support for the unpaid carer. Why? Well, there's lots of reasons, you know, legislation. So the Health and Care Act tells us to do it. The Health, you know, the Care Act tells us to do it. The Children and Families Act tells us to do it. It's about improving patients' experience. You know, it's about improving health inequalities. It links to the NHS long-term plan. It links to the Change NHS document, and it links to the guidance, you know, the NICE guidelines in terms of supporting unpaid carers. But really, why do we do it? Because it's the right thing to do. It's absolutely the right thing to do. So we can have all this legislation, but do you know what? Supporting carers will reap rewards right the way across the board. So how are we doing it? So previously, there has been some really good partnership work done between Newcastle Carers and Newcastle Hospitals Trust. So we were afforded some grant funding through the Newcastle charities to support the post of a hospital carers information and advice worker in the trust up until a couple of years ago, and that was Alistair. What we did, or what we've done, is extended the work that has been done previously to include the work, you know, done through Northumberland through Northumberland Carers Centre and North Tyneside Carers Centre and the Northumbria Healthcare Trust. So the two trusts sit side by side. It's a postcode, you know, perhaps half a street that, you know, separates the two out. And what we've done is we've been offered by the trust an honorary contract, and that's been awarded to the Hospital Employer Engagement Officer, that's Alistair, and it mirrored that of the Newcastle's trust. And what that did was it's enabled Alistair access to and effective communications right across the trust, interactions with key staff and staff teams to raise the profile of support that's available. So particularly, you know, across phase team. Sorry, it just appears that she's just dropped out of the call. So working within her team to support the work that they're doing across her HR function, across their comms teams, signposting and referring staff into the project. Yeah, signposting and referring patients, family members into our project as well, and collaborative working with the ultimate aim of improving outcomes for both trusts and their workforce. What that does for us is it adds value to the current offer that Northumbria Healthcare Trust give, but what it really does is supports the retention and experience of that skilled staff that they have. And they have a lot of support. So in terms of support, they have their staff intranet, which offers access to trust carer-friendly policies, or, you know, the request for carers to access flexible working, carers leave, special leave. The trust have a staff carers passport, which means that, you know, carers who are working within the trust only have to explain their story once to their line manager. They have a really good staff carers network, which has just sort of taken off and gathered absolutely huge momentum over the last week or two as we've relaunched it. Obviously, staff have access into our project, they have access into carers centres, and then within the intranet, there's a wide range of support available in terms of information, web links, locally, regionally and nationally. And then in terms of support, that's outlined to the general public, again, on the web pages, wide range of carer support, useful web links, and again, from local, regional and national services. And if staff want to be referred into the project, they can be made through phase team, through the patient experience team, or if they want to bypass that, because we appreciate that for whatever reason, a lot of staff carers may not necessarily, you know, in the first instance want to make themselves known, then they can refer themselves into the local carers centres, and the links are, you know, there for them. And just in case, and I'm not here to teach you how to suck eggs, you're unaware of, you know, what local carer centres offer, it often depends on how they're commissioned, you know, but all local carer centres, and there will be one in every area that you're working in, will offer information, advice and support. You know, they're part of the prevention role under the Care Act, which means that, you know, they will provide information, advice and support to unpaid carers to help them make informed decisions about, you know, where things stand going forwards. But you can see from the slide here that each carer centre in the 3 areas that we're working does offer things slightly different. And that could be, again, because they have accessed different grants or secured different funds through other means in order to offer those services. So, for example, in Newcastle, we have an asylum seeker and refugees project, which was funded through Carers Trust. We also have complementary therapies, which was bequeathed to us. So some money was bequeathed to us as an organisation to enable us to offer those to unpaid carers. But the majority of carer centres will also support young carers and will support parent carers of children with additional needs. I think that just about covers it. But if you do need any more information, you can contact any of us. And I'll just, before I stop sharing, I'll ask if Faye wants to add anything to what I have already mentioned.
Thank you, Fiona. I think you've given a really comprehensive overview of the brilliant work that's been carried out through this project. I just add that it came along at a really great time for us. We already were starting to look at developing strategic priorities for carers, and we were starting that work and had identified our main priorities, but then wanted to pick out some specific themes to focus on. And one of those was our staff carers and working carers. So this opportunity came along just at the right time when we could actually capture that and gather some momentum. And I think the great benefit as well of this work is because it covers the region and the 3 carer centres. Obviously, our staff work and live in different areas. It's great to have those links in and have that breadth of referrals and pathways as well. That's been really helpful. I think one of the other things that maybe Fiona hasn't quite pulled out of some of the work that she and Alistair have done is some of the presentations they've done within our trust, for example, to some of the senior managers, sort of outlining the kind of issues and concerns that some of our staff have been raising as working carers, but also the types of good practices that we could be following as a trust. And I think that's been really beneficial, and hopefully that's one of the things that with the continued funding we'll be able to build on. And those kind of links that Fiona and Alistair started building with our HR staff, with our kind of wellbeing offer as well. That's one of the other things we have in our trust is a really good wellbeing offer. So we have lots of benefits for staff. We have access to gyms, to classes. We have lots of resources, access to counsellings. It's a great resource there for some of our staff carers as well. That kind of well-being element is really important for a lot of them. And I agree with Fiona, that kind of consistency or lack of consistency is one of the key issues that we've pulled out from our work. And I think that's particularly apparent with some of our frontline staff and staff who are medical and patient facing. I think there's a lot less flexibility for them and from their managers around adjustments to their working practices and helping them to stay in work. That's where we seem to get most of the feedback where people are struggling. And I think that's more challenging. So I'm looking forward to seeing what kind of work we can carry on in the future and how we can start addressing some of those issues.
Brilliant, thanks Faye.
Fiona, thank you so much. And Faye, that's absolutely fascinating. I've got notes. We're going to go to questions. Alistair, I noticed, has joined us, but I'm also aware, Alistair, I don't know if you would feel comfortable coming on or putting your camera on or just saying hello, or don't want to drop you in it. But the reason I wanted to bring you on was because of the question that has come up in the chat box about impact. And I just wondered if you would mind, because you must see the impact of your work every day.
That's right, yeah. In fact, well, at the moment, because I'm based between Newcastle carers in the hospitals at the present time until the end of March. But you're right, the impact with working within the hospital setting, both within this project and over the years, is it's quite enlightening really to see, both from a staff perspective and staff carers perspective, as well as carers coming into the hospital settings in general, being connected and informed on what support is out there. I think, and the fact that they are a carer themselves, that initial identification of carers, for people to appreciate that they are a carer in the first place, that's one of the main challenges. But also, once you see people and you've supported people to be connected to the right avenues and the right support, you can see the difference in people's lives now, whether that's members of staff, or whether that's the wider families even that can be impacted on a situation at hand. It's I think it's from the perspective of that kind of resource and the impact and outcomes, it really is, having that drive, whether that's a dedicated person or people within a trust that's helping to drive that agenda forward, to be able to raise awareness both with staff internally, what resources available, but also the wider public, what resources available as well is one of the aspects of the work that we've been working with communications side within the trusts, getting that joined up as well, with Fiona's support and Fiona and others, from both trusts. We've got the working for carers as well as both trusts linked in, the comms leads within each trust, so we're reaching wider audiences through communications going out. But the outcomes and impact is it is quite phenomenal when the challenge is having the ability to be aware of what resources available, have that logged, and have the ability to be able to signpost people and refer people to the right support that's needed for an individual, tailored to their needs. So it's not overwhelming. But does that make sense?
No, and I think Fiona spoke about identification. I've done carers presentations, and at the end of the presentation, people come up to me and said, "I didn't know I was a carer." Literally, at work doing this, but and I just so that kind of what you're doing, raising the conversation and just physically being there, Alistair, just your very presence, if you like, is sort of supporting that and having that impact about just getting people to. We need to refer people to the local experts. Fiona, I thought your slide, Fiona, with the 3 carer centres and what they do is fantastic. And it highlights that notion of getting people to the local experts. We'll talk about Faye, can I bring you in, and then we'll talk about carers assessments after there's a question with regards to that. But Faye, sorry.
Just really quickly, just to add to what Alistair said. Alistair has very kindly come along. We have some staff listening events. Alistair's very kindly come along to a couple of those, and Alistair and Fiona presented to our staff carers network. Out of that, we've had people asking for one-to-one support, and it's that personalised support that Alistair's just talked about that has really benefited people. We were doing some stalls yesterday at various sites for Young Carers Day, and someone came up to me who'd actually been on the call and listened to the presentation that Alistair and Fiona had done, and she came up to say thank you, and she took away more resources and was going to go off and have a conversation with her manager. So that kind of direct personal impact. It's not about numbers. It's not about numbers of people that you've helped to support. That's not necessarily, I know we measure, but actually the impact on individuals being able to stay in work and feel supported and maybe having a conversation with their manager that they may not felt equipped to have, that's massive, and it has a massive impact at a personal level. I just wanted to kind of convey that, because I think that's really important to understand.
And I think what you say is bang on, because it is that notion. I think Fiona, wonderful slides, very sort of mentioned the fact we've won the moral case. I'm sure nobody says to you, no, we don't want to work with carers. No. But now I think what you're doing is we're starting to win the financial case as well, where the chief financial officers at trust and providers are starting to get interested in this because of those bullet points, Fiona, that you shared with regards to the financial argument with regards to doing this. We know workforce is the big thing at the moment, and keeping good people is really important. And I thought, and thank you, Fiona, for your personal reflections on that as well. That was much appreciated with regards. But as I say, that's the audience now. Let's start doing that, and thank you for evidencing that. Carers assessments. The question is with regards how we're linking this work into carers assessments and those eligibility outcomes around employment. Can those lead to referrals to this service? Thank you, Ingrid, for your question.
And the answer to that question, Ingrid, is absolutely yes. So, if we can get people into our project, or if we can get people into the carers centres, then the carers centres can support them into statutory carers assessments, either through the local authority, or some will do them on behalf of their local authority. They may have been outsourced. So we've also done some work, and I can only speak for, the 3 local authority areas that I work in, but we've also done some work with their staff to say, this is the project. We know that in terms of eligibility for support and services, that, being unable to maintain or engage in employment, education or training is one of the outcomes that makes carers eligible for services and support. So they know about the project and can signpost and refer carers into us through social care, or we can in turn refer our carers into social care through our services. That's the idea. So that's a long-winded answer to yes, absolutely.
But I think what you're doing is you're highlighting one of the key areas that we're looking at the moment, which is collaboration. My experience is that we are better together working for carers. We can't do it, and if we've got silos, then it reduces identification. This is one of those. I think the caring agenda is an absolute classic with regards to Darcy's 3 shifts, for example, and about looking at better ways of working together for a population, and we've got evidence that that works. My next sort of thinking on it was with regards, how do you work with carers that don't want to be identified? I wonder why so many staff in the anonymous surveys tell us about their caring, but when we start actually people having to say that they're a carer officially and writing it down, I know then certainly the numbers are less. How do you manage that? How do you work with people that might not want to talk, that might feel that disclosing their caring responsibilities might be detrimental?
I think, again, Faye might be able to jump in here as well, but we've had some brief conversations with HR leads, and we've had some conversations with the strategic HR, and I think it's about when we ask that question and how we ask that question. I know the Trust have been looking at, do we ask that question on our application? Do we ask that question, as part of induction? Do we ask that question at a particular point in time? I think for a lot of carers, I think it is about fear, that if they disclose that they are an unpaid carer, then it is going to effectively stop them getting a job, get that promotion, etc., etc. So I think for us, it is about making sure that all that support, etc., is in place, that it's not just tokenistic, that it is genuine support, which is what Northumbria have in place. That means it makes it a lot easier for carers to disclose because they know that they will be supported. And it's how we can then do that with other organisations and other businesses, because actually the population's getting older, we're living longer. And most of us will be carers at some point in our life. We underpin everything. We hold, we hold things together. So it's really important that people feel that they can share that without any fear.
Sarah in the chat has made this comment about culture, and it's always been one of our cliches about the carers' work is culture change. It's not something that will change overnight. It's about changing attitudes. It's about working together. And I know, for example, young carers are some of the most mature, well-grounded people I've ever met in my life. And from an employer perspective, you could see the advantage of employing a young carer because of those skills that they have developed. So, and it's through projects like yours and thank you, Steve, for conversations like this that I think is changing that culture. Faye?
Yeah, I agree. I was going to say it's about cultural change, but I'm thinking of a specific example in our trust where we have a template for wellbeing conversations, which should be offered by managers. And this is a more informal check-in. And there's a kind of a template in guidelines, and it can include questions about caring responsibilities. And that doesn't mean you're having to actually officially have it documented that you're a carer, but it might be opening the door into a conversation.
Right.
and to actually start reflecting on, well, yes, I might have these responsibilities, and how is that impacting on my work, and what can work do to support it? So it could start as a kind of a more informal conversation.
Yeah.
But we need to get our managers trained up to use that tool and to start using that kind of questioning as well. But that might help people to feel more safe and secure about opening up more about their personal lives and the pressures they're facing.
Yeah. And I think that answers the question that came into the Q&A with the chat box with regards that how do you make information about carer support through the employer available to young carers who might just be starting in employment? And it feels that you're doing that. Do you, Faye, from what you said, am I right to say that information would be part of induction as part of the offer to staff?
It's not a specific part of our induction, but it's something that should be offered as part of your progression
Part
and
of
your
the health and
supervisions
got it.
and
Yeah,
and
cool.
your health and well-being. The health and well-being offer is quite well publicised as well.
Brilliant.
So.
No. And I imagine that wasn't there sort of 5 or 6 years ago. You know, I think that this is what, you know, and again, that's part of the culture change. That's part of it's through conversations like these that the people that build those forums start adding this in, you know, and that's why remain optimistic about the culture changing as we're moving forward. Right, we've only got, I'm going to try, and definitely, it's time to go on, Fiona, sorry.
Sorry, I did spot a question, and I was going to try and answer it in the chat, but then I've lost it again. It was about outcomes in terms of the project. I can't see who it was now, but there will be a report put together at the end of the project in general, not just linked to the work that we've done within the NHS. I think it's an external agency that's going to be writing that. So what we can do is, when that's available, we can let you know where that can be seen / shared, just to look at the outputs, because we were set, obviously, as you would be, set certain targets in relation to, you know, our outputs. So we'll be able to let you know what they were and how they've been met.
And now's a good time for me to say, I've got words that I need to say. The presentation slides and recording of this webinar will be made available on the future NHS collaboration platform. And to gain access to the carers workspace on the platform, please email the regular email that you've all got, the england.nhs.carer, or contact Steve direct. Fiona, if you are allowed to publish that, if you're allowed to share it, can I ask that you send it through and we'll get it up to the platform alongside the notes with this outcome? So thank you very much. Just Steve's mentioned about bereaved carers. I don't know, Steve, is that something? Is this sort of particular?
It's just something that's been coming through recently, Campbell.
Yeah.
So I was just wondering if Fiona and Faye might have come across any bereaved carers in terms of, you know, how they're identifying and offering them the support need that they need, really.
Okay, so I can only speak on behalf of the carers centres. I know that the vast majority of carers centres, particularly in Newcastle, will offer specific support to carers who are bereaved for up to 12 weeks after that bereavement, and then that carer is still able to access I'm going to say more generalised support, such as carers coffee mornings, where they may have already made some connections previously to being bereaved, and can continue to maintain those connections through that. So it's something that's written into the carers centres service spec and contract, because we recognise that can be a really difficult time for people. So affording them that additional support and then allowing that support to continue through peer support is something that we're really, really keen to continue with. I think in terms of leave, obviously there is, from any organisation, they will have bereavement leave and additional support available. But Faye may be able to tell me a little bit more about the NHS offer there.
I think it's just the standard leave. Interestingly enough, one of the first listening events we had, where we hosted a table on, it was a rotating session so people could go between tables, and one of our themes was working carers. A lady came along who said, I saw the invite and it spoke to me. She'd just lost her husband and she had been caring for him and had real difficult time actually taking time out for her caring needs, and was feeling really bereft, didn't know what to do with herself that evening, and thought, I need to be there tonight. And she came along and we were able to speak with her and give us some resources. I wish I'd known, Fiona, about your project, the bereavement support, but I mean, this is all about knowledge sharing, isn't it?
Yeah.
Because we would have been able to potentially signpost her to that. But yeah, I think it's massive, and I think she didn't feel understood by her team, and the impact that after caring for so long, is a week's leave isn't going to cut it, is it? When your whole life has been turned upside down and all your energy and focus has been on caring for someone, and you've lost someone in such a difficult way. I think that understanding and flexibility from the workplace is really important. So maybe there's a bit of work around that, Fiona, going forward.
Definitely.
Great question, Steve.
Better together, as I say. And I think I'm going to start bringing us to a close now, because I like to give people a few minutes extra before they go into their next call. So could I just, what I thought I wanted to do, as a way of closing, actually, I wanted to pick up the comment that Sue Tressman has made. I'm going to read it out. But in times of financial challenge for systems and partners, carers may feel vulnerable in a competitive employment world. I fear, how can we best offer reassurance? Steve, I think that comment is worth a webinar on its own. I think it would be really interesting to look at that at some point going forward, with regards how do we, as people that get it, kind of support that change. And I think it links into the work of Fiona and Faye with regards to that kind of notion of culture change. I'd like to think that all of the calls that you put on, Steve, with regards to the work that's happening, answer that question. But I wonder, maybe at some point going forward, that we could maybe think about having a joint discussion on it, maybe having a session just to have that conversation. So I think that's really important, and I think it's at the heart of, we need to get that right. We need to, as part of the culture change. So that's what I mean about, I want to use that to wrap up, because I think that what Fiona and Faye are doing is starting that conversation by this joint working, collaborative working, getting better identifying carers and getting into the local experts is what we need to be doing across the country. So with that, I'd like to say thank you, Fiona. Thank you, Faye. Thank you, Alistair. I think he's probably dropped off now to go and see carers. So please send my regards and thanks to Alistair. And Steve, thank you for hosting. And I'm sure I've missed something. I've got all these words to say. I'm sure there's a paragraph I've missed. Have I covered everything?
Anytime, Campbell, anytime. And thank you for everybody for attending. It's really appreciated. And like we said, like Campbell said, any suggestions for any presenters or work that's going on within your regions that you think are worth coming onto these webinars, please do reach out to me, and we can see if we can schedule them onto the schedule. So yeah, thank you.
Have a good day, everyone.
Thank you very much.
Thank you.
Thank you.
Bye.